Hello, OT friends, and welcome to the Uncommon OT series. I'm Patricia Modis, and I'm your host, a Filipino-American, native New Yorker, currently based in Los Angeles, bulldog mama, and an uncommon occupational therapist myself for the past 22 years. On this podcast, you will hear me proudly feature the unique careers of occupational therapy practitioners working in non-traditional and role-emerging practice areas, settings where OT is uncommon. I invite you to receive a dose of OT inspiration, to learn, to think outside of the box, and to be energized and motivated to follow in these unconventional paths. Happy listening! Before we begin this episode, I want to extend a special thanks to Picmonic, our sponsor. If you are an OT or OTA student looking for an excellent learning resource and study aid, Picmonic might be for you. Whether you're studying for your classes or getting ready for the NBCOT exam, it is a visual mnemonic learning tool that has been research proven to increase retention and help students ace their exams. It uses audio-visual learning and intelligence-based repetition algorithms to help with long-term retention while studying. If you're interested in trying it for yourself, sign up today using the link in the show notes or using the code TRANSITIONSOT to score a discount of 20% off your Picmonic membership. Welcome back, OT friends. Today, I'm very excited to introduce you to our guest of honor, Corrin Campbell. Corrin is an occupational therapy practitioner whose work centers around client navigation. Welcome to the podcast, Corrin.
Hi, I'm so happy to be here.
Thank you so much for taking the time to share with us what you do.
Thank you. I'm really excited to be able to share with you today.
Wonderful. So I'd love for you to get us started by maybe telling us a little bit about yourself, maybe some of your favorite occupations.
Great. I would love to share with you. So, other than spending time with my husband, son, and snuggling on the couch with my dog, the ocean is really my happy place. I am an avid beachcomber and I have an extensive sea glass collection. I love to collect all forms of other people's trash, which I consider my treasures. I really love to paddleboard and I'm a total foodie. And ultimately, I think if you had to pick one occupation that's my jam, it would be attending live concerts. They're my favorite.
Oh, so you and I have so much in common. That's why we clicked right away.
Yeah.
And other, between the beach and eating and going to live concerts, those are also a few of my favorite things. And another thing you and I have in common is how passionate we are about our occupational therapy profession. And another part of that is that how long we've been practicing in our
Yes,
profession. So I think you and I are tied.
I agree.
Yeah, so, with that said, your passion for occupational therapy runs deep. Can you tell our listeners what motivated you to contribute to the podcast today?
Oh, yes. Everything that you do on this podcast sings to me because our profession is so diverse and we have such a holistic approach that there really is a distinct value to utilize our skill sets in non-traditional areas. And I really love that your podcast highlights this so clinicians can be reinvigorated and inspired to continue practicing occupational therapy.
Yes, thank you so much for being here to share your uncommon OT work. Um, this is, exactly what we're hoping to do with this platform is to, spread the word, inspire other occupational therapy practitioners, and, really give them some kind of a blueprint to follow. And in your case, it is helping clients navigate their
Yes.
diagnoses and their conditions. This might be a really good time for us to move towards that. Can you describe for us, Corrin, your uncommon OT work and what you do, where you practice, whom you serve, and maybe some of the needs that you address? I know that's a mouthful, so you can start wherever you want.
Sure, sure. So I'm currently using my OT skills under the title of Director of Navigation. And that sounds like I'm steering a ship, which I am not. Well, maybe I am in a way, right? Helping you navigate uncharted waters when you receive a diagnosis of cognitive change. So essentially, you receive a diagnosis. Now what? So I help co-create post-diagnostic plans with people living with cognitive change and their families, which really helps them early on in their journey decide kind of what they want, when they want it, the if then type of scenarios. And it can be daunting when you receive a diagnosis. So helping people to kind of take a breath and realize that there are lots of choose our own adventures in this process, and that journey is not the same for everyone, right? It's really distinctly determining what's your journey and how you want it to lay out.
Yes, and of course, factoring in the person's family, environment, and
Yes.
occupations, right?
Right.
So much, much needed service. Was there anything in particular that drew you to this type of OT work? I know you've done so much, and feel free to share with our listeners a little bit about that.
Yes. It's interesting. I started out my career with birth to three and early intervention, thinking that I was going to work with children forever. And that lasted all of about 6 months. And I decided, you know what, this is not for me. And that's great, right? What is more fabulous about our profession is than having the diverse practice areas. And so I decided to immerse myself in supporting adults. And so I really have been passionate about supporting older adults throughout most of my career, other than that little 6 month stint. And particularly, I just found a focus and interest on individuals that were experiencing progressive neurological disorders and really helping to more deeply understand what that experience is for people with Alzheimer's and dementia. And so
Yeah.
started out in skilled nursing and then kind of shifted into home care. And so really having traditional practice areas to start my OT work has led
Mhm.
me to really being able to think out of the box in this non-traditional role.
I have friends, family members who suffer from Alzheimer and other dementia types of conditions. And it's a struggle
Hmm.
for them, the caregivers, for just the amount of decisions that need to be made about the various things. So I love that you found a place for OT and providing the service. Can you talked about some of those experiences. Can you share with us sort of how you paved the path towards doing what you do today?
Absolutely. Absolutely. So I think, starting in, like I said, in skilled nursing, short-term rehab, that area of practice was predominantly older adults. And so over
Yes.
the years, became more and more aware of the stigma that often accompanies the diagnosis. So you're doing a chart review and you see a diagnosis of Alzheimer's with or without behaviors. You see dementia. You see, these words that all of a sudden lead to a bias within our healthcare team, and these
Hmm.
biases start to shape how that person is viewed even before they've been evaluated or treated, and it's reducing them to their diagnosis rather than seeing them as an individual that has needs and interests and life experiences. So I used my OT lens, focusing not only on the diagnosis, but the person that was behind that diagnosis and taking time to
Hmm.
get to know their history, preferences, values. And I really started to see the benefits of modeling respectful and empathic communication with patients and colleagues. And boy, did I have some amazing results from those
Hmm.
efforts. And so when healthcare teams truly understand that the person they're caring for is a person, not just a diagnosis, it really starts to foster a more compassionate and effective environment. And ultimately, that improves outcomes for the client, which is a win-win for everybody. And so I took those skills again with now I started with the let me teach you to fish versus give you the fish. And so because I really enjoyed public speaking, I really tapped into providing in-services and coaching sessions to clinicians and teams that were struggling with approaches to care and experiencing those barriers to therapy treatment, right? They have dementia. There's no new learning. They're quote unquote behavioral. I can't get my therapy sessions done. And as I helped to identify what are your barriers to therapy treatment sessions, and let's look at this from a strengths-based approach. It led me to my current role at LiveWell, where I'm able to educate providers, navigate families to supports and services, really with this emphasis of autonomy, reducing stigma, and highlighting people's remaining abilities versus what they cannot do. And I think that that is super important because culturally, here in America, you receive a diagnosis of cognitive change, dementia, Alzheimer's. And in addition to this layer of ageism, you now are experiencing a stigma due to a diagnosis of dementia. And what we tend to do is we think we're being supportive and helpful, and we start taking away the independence that that individual had. So they walked into a doctor's office, received a diagnosis of dementia, walked out of that doctor's office, they are still the same person. However, as a family unit, the fear that is underlying with that diagnosis now causes the daughter to say, Mom, you can't pick up your granddaughter from the bus stop anymore. Mom, you can't drive anymore. Dad, you have to quit your job. And so we take away these levels of independence and autonomy, thinking that we are helping someone be quote unquote safe. So it's really my role and my passion to really flip that coin and say, what are all of the remaining abilities of those living with cognitive change, and how do we empower people to have autonomy through this journey?
Love that. And, as you're talking, I'm hearing occupational therapy. I'm hearing you using your holistic lens. I'm hearing you using a strength-based approach, some motivational interviewing there.
Yes.
And what I didn't realize was that you were also educating providers through this role. And, that, of course, will have a ripple effect too. But this is a win-win. You started out by saying that, right? That this is sort of a win-win because here you are, an occupational therapist, which I think is super well suited for this position because you're able to identify these needs and gaps. And in fact, have already come up with quite a few ways to fill them.
Yes, absolutely.
Congratulations on that.
I mean, it only took 25 years, but I got there. No, I'm kidding. I mean, I've been doing this role for a little over 6 years, where I am currently at LiveWell. And prior to that, I was very fortunate that the home care agencies that I worked for allowed a part of my time off productivity to be able to actually go out and speak to providers and referral sources, physicians, social workers, et cetera, to say, hey, you referred this patient or client to us, and I would like to show you the benefits that now your patient has not been rehospitalized in 6 months, or really giving the data back to providers. And so in my current role, that's another thing that I find really helpful is saying, if we equipped these clients and their families with the tools to not have to have frequent flyer emergency room visits, right? Because we're building the capacity of the care partner, we're building capacity of the person living with cognitive change, to be able to have scenarios that don't always end up in the emergency department. Like you said, it's a win-win. Everyone is benefiting when you're building the capacity of the clinicians to be able to carry over and have sustainability, but also the care partners and the person with lived experience, because ultimately they're driving what is going to be their symptoms, their how to help them reduce their symptoms, how to help them express themselves and communicate in ways that it's paramount to be able to really have someone at the head of the table. We don't do things for them, we do things with them.
Yeah. I'm so proud of your work. Again, I talked about how I thought it was such a much needed service, and really grateful too that you're out there advocating for occupational therapy uh, to the rest of the healthcare team, right? Or to the other providers that are part of the
Yes.
big picture.
Yes. We have to promote ourselves in whatever traditional or non-traditional role we are in. We got to sing it on the mountain. We've got the secret sauce in every practice area we're in. And so how do we really have a voice and be proud and share?
Yes, I love that. So, how do you do it? How do you share? What is a typical day like for you? Can you describe for us? I don't know, would it be a session or would it be, and again,
Well,
you
I
start
guess,
wherever.
yeah. So I was thinking about this. What is a typical day? It's kind of a new adventure every day, which I think is why I love it so much. So we have the ability to have, in person or virtual navigation visits. So I have the unique ability to, because I'm not a billable service, we're a free service, I can actually navigate with people that right now I have somebody that's in Oregon. I have someone that is down in Florida. So I have the ability to do virtual navigation visits and also in person for clients that are local and can get to me here in Connecticut. And so what I do is I work closely with the individual and families to understand what their unique situation is. So, like you said, utilizing the motivational interviewing techniques to really look at what are your hopes, like what are you most hopeful for? Because oftentimes people will come to me in a reactive state, right? They're not all coming to me proactively. There's some sort of reactive reason of why they're coming. So I really want to know, what are your concerns? What are your needs? But then kind of listen to what's not being said to really help come up with a big picture. And this approach really allows me to uncover what they're hopeful for, but also acknowledging that many of them are grappling with this emotional weight of a new
Yeah.
diagnosis. And I say new diagnosis, but remember that being newly diagnosed doesn't always mean that they're early in their stage of condition. Often they
True.
may already be dealing with significant challenges that they've either been able to utilize their own adaptive strategies for, or we're chalking it off to maybe oh, I have perimenopause, or I'm super stressed out and busy, and not really identifying that those are brain changes that are happening
Hmm.
related to dementia. And so, during these appointments, I encounter people who are understandably ambivalent, scared. At times, maybe they're feeling helpless or even hopeless. And so, one of the key skills that I use to create a supportive environment is that active listening, right? That
Hmm.
helps me better understand their feelings, validates their experiences, and making sure to offer that empathy throughout the conversation reassures them that their emotions are natural, their journey will unfold in its own time, and you're not going to solve the world's problems in an hour with me, right? It's
Hmm.
going to take some time to digest and reflect and really look at, yes, you may have multiple opportunities to tap into supports and services, but what is the most important thing for you right now? What is the number one thing you need? Do you need to join a support group? Do you need to work with a therapist, an LCSW?
Hmm.
What is the one thing? Do you want to just take some time to do the 5 wishes worksheet, right? In the event I'm not able to communicate my wants and needs, these are all the things I want you to know. And so I may work with someone and then not hear from them for 2 months because they've gone home and they've had homework, and
Hmm.
so really it's looking at what those individualized needs are and trying to tease out one or two things. It's kind of like when you're on a wellness or a fitness journey and you want to do all the things at once. I'm going to drink all the water. I'm going to sleep. I'm going to jog, and then you get super bogged down and overwhelmed with all of the things. I try to have as, little bits by little bits, and I think that the other essential aspect of my work is providing that education, specifically focusing on prevention. And so when we say prevention, and you put prevention and Alzheimer's or prevention and dementia in the same sentence, it could be a little jarring, right?
Yes.
And I frame this education through the lens of reducing symptoms and addressing difficulties before they escalate. So if you have a diagnosis of cognitive change, we're preventing symptoms. And that helps to empower those individuals and families by giving them the tools and strategies that they can implement to manage whatever their specific challenge is, while fostering this sense of control and hope. Because I think that when someone receives this diagnosis, they just immediately are like, that's it, I'm done. And it's like, no, nope. There are lots of opportunities to still have control and hope. But also this prevention, right? This is like the big buzzword right now of how do we prevent brain changes? And there are modifiable risk factors that every single one of us can actually utilize to prevent brain changes. And so that's like a whole nother podcast. But
yes,
it's that, when you're looking at being informed and identifying what are the top, there's 14 modifiable risk factors and we can't change all of them. But are you focusing on reducing your stress? Are you getting enough sleep? People who sleep 5 hours or less a night over 65 are twice as likely to have a dementing illness than those who sleep 6 hours or more. And that's a really jarring statistic. So when you're, hearing loss is a contributing factor to experiencing cognitive changes, in addition to social isolation, poor nutrition. So really when you're looking at diabetes, right? They're calling it Alzheimer's type 3. Or diabetes type 3. Oh, good God, Gertie. I don't recall. Anyway, diabetes,
diabetes,
right?
Yes.
So when your blood sugars are jacking up and down, up and down, up and down, because you're not managing it properly, you're damaging your brain. So when you're looking at all of those things, yes, there is preventative strategies, healthy heart, healthy brain. But are you going to prevent Alzheimer's disease? Not likely, but there are modifiable risk factors that you can utilize to help you prevent brain changes.
Got it. I want to, we will sort of put a link to this resource because I think it's something that, our listeners would be very much interested in. And
absolutely.
Thanks for sharing that. That's sort of, I feel like I just got a little sneak peek in one of your sort of initial assessments and, really getting a good picture of what you're looking at, how you're having the conversation with your clients and, even some tools that you utilize to better guide your practice.
Yes.
Within the examples that you cited, I couldn't help but, see my grandparents kind of, slowly, progressively just deteriorating and, hearing loss, poor nutrition. Some of these factors that you mentioned were very evident in that, change. So again, circling back to the fact that, this is it's a much, much needed service. The aging population is increasing. There's just like so many statistics that kind of support this. But the thoughtfulness and again, the thoroughness and, the holistic approach comes from the occupational therapy lens and again, makes you so well suited, super, such a great match for this position.
Yeah, I was very
Um,
excited when this opportunity came up because I was like, this is what I do. I help to have people figure out what independence means for them, and this is it. This is a
yeah,
way, and empowering families, right? Because this whole top-down approach to being a caregiver, right? We're really trying to say, can you be a care partner? How can you partner in this care versus being transactional and saying, I'm going to do it this way, right? Because that's how a lot of the
yes.
symptoms and dysregulation happens when we do it our way, not their way.
Well, such great info. Let us talk about some highs and some challenges of your current role.
Okay. So, well, I think that the stigma of a diagnosis is a challenge because there are a lot of people who really could receive early intervention if they were to be brave enough to say to their provider, right? Their doctor, the primary care physician, their geriatrician, or even their therapist, right? I'm noticing dot, dot, dot. But the stigma that comes with dementia and even just aging in general, people tend to want to hide their challenges. And
Yeah.
so I often will find that by the time someone is coming to me for navigation, understandably, they're focusing on what their person can no longer do. And that leads to this unintentional fostering of learned helplessness or learned
hmm
dependence in that person. And so out of love and concern, they're taking on more tasks and actually causing their own burnout without fully involving the person. And so I always tell people in my navigation visits, what's the golden rule? Patricia, what's the golden rule?
The golden rule.
Do
Do
unto
unto others.
others,
Yes.
yes, as you would have done to you, right?
Yes.
But we follow the platinum rule. And the platinum rule is do unto others as they would have done to them, right? What do they want? Not
Ah,
what I want for you. What do you want for you? Because I may think that you want to go hike in the mountains, but really you want to go lay on the beach, right? And
yes.
so, how do we follow this platinum rule to really help people involve the person with lived experience? Because that is going to help them reduce this helplessness and loss of autonomy through empowerment. So that's one of my challenges, right? Is this not getting to people quick enough and having people kind of hide their symptoms. But I think one of the biggest rewards in my role, and I know I say this word a lot, hope is my favorite four-letter word. And well, one of my favorites. It's the appropriate one that I can say in public. So hope, is a really important thing. And when individuals and families are feeling like there is nothing but loss ahead of them because dementia is progressive. We can't undo it at this point in time. It can be really isolating, and it's easy to see why people might feel this sense of hopelessness as they're facing this uncertainty. But through my work, I've really found that even in the most challenging circumstances, there are opportunities to create moments of joy, connection,
hmm
having people feel valued, seen, and heard, and really having a purpose, even in their later to end stages of their journey. So seeing the relief and gratitude on people's faces when they realize that there's still hope, that is probably the most fulfilling aspect of my work.
Oh, I love that. And, particularly for your clients, right? I mean,
Mm-hmm.
I'm sure, for some, it's been a while since they've felt connection and joy and purpose. And there sounds like there's such a strong mental health aspect to the work that you do.
Yes, absolutely. I think the education that we receive in our OT schooling really speaks volumes at our ability to collaborate in multi and transdisciplinary approaches with other team members. My partner is a social worker, and she and I work very closely together to really make sure that when we're providing resources and wraparound services, that we're really looking through those lenses of, psychosocial, emotional components in addition to your physical and cognitive abilities.
So again, very OT.
Very OT.
I love what you shared about the platinum rule that we're going to have to somehow quote you on, because that also spoke OT from the mountaintops.
Absolutely.
So let's switch gears a little bit. You mentioned a partner. Can you talk to us a little bit about your role at Live Well and, maybe some money matters, anything that you feel comfortable with sharing? Or you talked about the service being free, but how do you get paid by Live Well?
Sure. So I am really, really fortunate that I work for a nonprofit organization that has been operating for over 30 years. And it originated when there was a call to action because there wasn't enough support in Connecticut for people with Alzheimer's disease. And we originated as a 120-bed skilled nursing facility. And over the years, we have grown and expanded. And so we have a service line called the Live Well Institute, which is our grant funded scholarship and research kind of leg of our organization. And so we have the ability to provide a lot of no cost to the client and family services because of all of these lovely programs and receiving local and national grants to kind of expand the boundaries of best practice for dementia, and in Connecticut and again across the country, as I do provide navigation all over as people need it. So my organization is unique. They employ OT practitioners in all areas of the organization, some as facilitators and educators, others as researchers, and then, of course, fabulous traditional treating therapists, because we can't function without them as well. So I am a salaried position. However, my services are complementary to my clients.
Oh, wonderful. And I love hearing that there are OTs on all levels.
They are. It's so funny. People will say, I do like a little Live Well 101 class where I just overview all of the programs and supports and services, because originally people just thought of us as a residential community, which we were. And now we have done an expansion where we have our Resilient Living Center, which is a community-based hub for all things well-being. It's created to focus on all of our cognitive domains, but it's in a really fun atmosphere and kind of like a college model where you choose your classes and your programs. And so really trying to explain to people that we are very multifactorial, not just a skilled nursing or long-term care and assisted living, but beyond that, really our mission is to how do we redefine what living with dementia is and get as upstream as possible to people like you and I, where we can really inform how we can protect our brains.
Yes, I love that expansion. It reminds me a little bit of this that I've seen online, this cafe in Japan, I believe, that employs folks with dementia. Have you seen that one?
Yes, it is fabulous. And you get what you get and you're not upset. I love that. And, I think that we can learn so much from other countries as well, right? We've spent some time in 2018. We went over to Scotland and worked with Dementia Scotland to learn about all of the ways that they have such inclusive communities, and then spent the pandemic translating that to the American way, because we know that socialized medicine is very different than how we operate here. But the creation of our entire campus had that lens of inclusion and belonging, and that is such a non-traditional approach to how you support people residing in a communal living environment, right? There's not these locked doors, there's autonomy,
Mm-hmm.
it's just very different, which again is not for everyone, right? Because culturally we look at, you have dementia, you need a locked unit, you need to go to memory
Yeah.
care, right? But our entire campus is memory supportive in that you have the autonomy to go to class. If you need support, we will wayfind
Mm-hmm.
with you, right? But if what crime did people commit that they receive a diagnosis of dementia and now they need to be locked up forever?
Yeah.
So really trying to blow people's minds with how we support people with cognitive change.
Yeah, and I love that OT is a big part of that and the big part of that transition. I think we're learning a lot about just being kinder humans and
Yes.
being more inclusive, right? And what you're doing is going towards that direction.
Yes.
The empowerment piece is really incredible too. I think, you mentioned shame and folks typically hiding once
Hmm.
diagnosed with this, and I've experienced that in my own personal life. And just giving folks the tools to be able to talk about what they're going through. Sounds like there's a big sort of shared decision making process that
Yes.
you're a part of, and um, informs them at the same time of what their options are, and ultimately you're ending up in a better place because of all that.
Absolutely. Really just giving you a toolbox that fits your needs. Because if you're someone who is experiencing brain changes and language is the primary challenge for you, you're not going to hop on. We like to use the lily pad analogy at LiveWell, where you have a whole lily pad, you pond full of lily pads, right? And so in your pond full of all these lily pads, these are all of the opportunities for you to connect and receive supports and services, but you may not hop on to half of those lily pads because they don't pertain to you. And what we've learned
Mm-hmm.
over 30 years is that there's a lot of things that aren't going to need your attention because it's not going to be a problem for you. And so
Yeah.
how do we get you onto the lily pads that meet your needs, fill your cup and meet you where you're at, right? Not just meeting your needs, but where are you in this moment? You may sit
Mm-hmm.
in on the lily pad of a support group for 2 years and that may be all you need, right? But then maybe you're going to need some help in the house, or maybe you need some OT services, or maybe you need speech therapy, right? My role is to help navigate your needs and strengths and really see kind of what the best lily pad is for you to hop onto.
Yeah. And meeting the client where they're at.
Yes, paramount.
So I'm sure that we have listeners out there who are very interested in following your path. There's a lot of listeners who work with older adults. I see a lot of potential in this work. I know you're a salaried employee by LiveWell, but I
Mm,
kind of see potential in this being some kind of private practice or an offering.
absolutely. Absolutely. I think that, there are a lot of quote unquote like nurse navigators, which are wonderful. Shout out to my nurses. They are fabulous. But I do think that you should poke whenever there is a role that lists all of the skill sets that you have as an OT practitioner. Apply and say why you think that this is a great fit for you. Because I think
Yeah.
that there are many practice areas that OTs are working in that you would never really imagine it being an occupational therapy role. However,
Hmm.
it has the entire skill set of all the things we do every day.
Yeah, 100%. So for this role, Corinne, was it something that you were offered, or was it something that you found on LinkedIn or
Yeah.
some kind of posting?
So LiveWell is very unique. They co-create roles here with us. And so I actually, for a few years prior, was working with LiveWell as an OT lead on the skilled neighborhoods. Again, non-traditional role, not a treating
Yeah.
position. And so it's a little unique with us that we kind of morph based on our interests and needs, and we have the ability to just try things.
Mm-hmm.
And so the navigation roles, my partner Shazia and I were both very interested in creating a role that would utilize resource coordination from our resource coordinators, but this navigation is more of a deep dive. And so, yeah, we kind of were able to tap in internally. However, I do
Mm-hmm.
think that there is lots of opportunity for creating these roles in other facets, right? Whether it's home care or even if you're looking at it through like a marketing lens, like there are people that work in marketing that OTs have a great opportunity to be able to educate through that lens. So if you're
Yeah.
working for a nursing home, and you're in a traditional treating role, like kind of zoom out and look at what you're doing and see if there's a navigation opportunity in admissions. Or,
Mm-hmm.
I think that there are a multitude of ways that navigation can be incorporated in other facets of treatment and practice areas, even in outpatient. If you're working
Yes.
in outpatient, I think that, again, if you want to leap, I always say leap and the net will appear. If you want to go out on your own and become a navigator, what you would be is kind of in that case management role, right? Where you have
Yeah.
people that are private paying for you to get them, navigating them through all of their medical things. And that is 100% something an occupational therapy practitioner could do.
Yes. Now, I know I'm kind of going off topic here, but just some questions, like side questions are coming through. Is this a role that's more common in other countries? Like, I feel like the navigator role is something that I've heard of in the UK.
Yes. So navigator roles. So in a socialized medicine model, people receive navigation, like lifelong navigation from particular clinicians that have a specialty area. I mean, they are following up with you and following you through your journey in a way that we haven't quite figured out exactly how that works over here. But yes, there is such a unique. If anyone has the time or interest to research European countries and their models of dementia support, dementia villages, dementia care, they really do have such a fabulous approach. And I do think part of it is because of the socialized medicine component. But I think that there's a lot that's translatable here. We just haven't
Mm-hmm.
really been able to tap into. I mean, UK has we have brought over Dementia Friends, right? Dementia Friends is a
Yes.
wonderful program, and now we're looking at, there's dementia capable care, there's dementia friendly care, and then there's dementia positive, right? And that dementia positive is the person with lived experience is at the head of the table, and we're following that platinum rule, right? Dementia
Yes.
friendly is also such amazing approaches, and it's just this evolution of recognizing that inclusion and equity
Mm-hmm.
for that person who is experiencing the changes to be able to inform us um on how they want their life to go.
Well, I absolutely love it. It's such a respectful service that you're offering. It's honoring, again, the individual and their choices. And I just see OT fitting seamlessly into this role. So thank you so much for sharing your wisdom. I know our listeners are interested in finding you, would probably want to be in touch. Is it okay if they are in touch and connect with you about your work?
Absolutely. I don't have a professional Corrin Instagram, but I have like my personal one. So anyone is more than happy to friend me there. And we can talk more about what I do. And then of course we have our professional Instagram and
LinkedIn.
Facebook. Yeah, that and LinkedIn. Yeah, LinkedIn is great too. So yes, people are more than welcome to come and chat with me on those platforms for sure.
Thank you for making yourself available. And I'm also going to list, the resources that you mentioned. We'll collect all of that, links to, dementia positive, dementia friendly, and even the modified risk factors tool that you use. I think these are going to be helpful tidbits for our listeners.
Absolutely. I also, now you're sparking a side thought from me as well. One of the largest areas that I see navigation for occupational therapy practitioners at an inlet is primary care.
Yes.
Being a navigator in primary care, if you're not so keen on going out and doing this independently, really tapping into your geriatricians that you work closely with, Geri-psych. I mean, all of these environments, having a navigator that's an occupational therapy practitioner would be fabulous.
I completely agree. I'm imagining the settings where I currently work, and I feel like we're kind of filling that role a little bit, but we have so many departments that I can certainly see a slightly different role in those settings too. So
Sure.
I know I'm speaking very vaguely, but because my brain is going in 5 different directions.
I know, we get inspired, right? We get excited.
We do.
And it's the OT way. We're like squirrel. And we hop off to the exciting things. It's just how we operate.
Yes. And, we work in completely different practice settings too. So that's kind of one of my favorite things about these dialogues and conversations with my fellow OTs is we kind of pump each other up. And, again, Corrin, I appreciate you so very much for sharing your wisdom, your knowledge, and your insights with us. Also providing us with great advice on, how to take the next steps if this was something that we were interested in moving towards. And again, just for spending part of your Saturday with me. Thank you.
Oh, I'm so happy to have been a part of this. I think that there's just nothing better than connecting with other OTs and sharing unique perspectives because we may not always be recognized at first glance for a non-traditional role, but there's lots of them out there, and we just need to really advocate for ourselves.
Yes, and thank you for sharing how you did it.
So happy to be here. Thank you for having me.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.